Welcome to Cork University Hospital. This is a patient information video about CT colonography. On the day of the scan, you should enter the hospital via the main entrance. Next, you'll pass reception on your left and continue down a long straight corridor. Before your scan, you will receive a letter with information about the date and time of your appointment. The radiology department is located on the ground floor. You can either take the lift down one floor or take the stairs as shown. If you enter from the accident and emergency side, you will already be on the ground floor. Simply follow the corridor until you see the sign for the Bluebell Suite. Here you will pass reception on your left, turn left and again right. Follow this corridor to the reception desk, where you will meet the administrative staff who will check you in and the radiographer who will be looking after you for the day.
Hi, my name is Breed. I'm one of the radiographers working in CUH. On the day of your scan, you will be meeting either myself or one of my colleagues. CT colonography is a type of CT scan performed using X-rays to look at your bowel. This can be done either in place of or as well as a standard colonoscopy. You may have this scan for a number of reasons. Colonoscopy may not have been possible, you may not be suitable for colonoscopy, or your doctor may have done a colonoscopy and not managed to get as far as they would like. CT colonography is a minimally invasive test that allows us to make a 3D map of your bowel so that we can examine it more thoroughly to find a cause for your symptoms. To get the best quality images, there are a few steps that you need to do to prepare for the scan. You will receive an appointment letter with the date and time of your scan. With this, you will also be given a medication known as bowel prep. This is the most important part of the process. Bowel prep involves drinking a liquid laxative the day before your scan is scheduled. If your scan is on a Wednesday, you should begin taking your bowel prep on the Tuesday. The reason for this preparation is so that your bowel is clear and the doctor reading your scan has the best chance to find a cause for your symptoms. You will also receive a small bottle of X-ray dye or contrast. This should be taken throughout the day before your scan. This X-ray dye will coat any remaining contents in your bowel so that we can easily identify and ignore them, again making it easier to read your scan. Your letter will also contain information about the diet you should eat before your scan. You should arrive fasting on the morning of your scan and have someone to collect you. The use of X-rays means that you are being exposed to radiation for the test. The amount of radiation varies depending on the type of scan you're having, but overall, the risk from this is quite low, and your doctor or healthcare worker that has requested your scan has balanced this risk with the need for your scan. Furthermore, we monitor the dose of every scan that is done, along with your previous scans and exposures, to make sure that we keep you as safe as possible. If you are of childbearing age, we may ask questions about your last period or prior pregnancies. This is to ensure that there is no risk of you being pregnant at the time of scanning, as unborn babies can be more sensitive to radiation from X-rays. Now that all your checks are complete, it's time to get you in for your scan. Once you're ready, we'll bring you into our CT room, where you'll see a large donut-shaped machine with a table in front of it. This is the CT scanner. You will need to lie in different positions for different stages of the scan, but don't worry, we will direct you. If you have mobility issues, please let us know and we can assist you with moving onto and off the CT scanner. We begin with you lying on your side. A small injection is given under the skin on your buttock. This is a medication that slows down the bowel to improve our images. As part of the scan, a small soft plastic tube will be inserted into the back passage. Unlike a colonoscopy, this tube is only inserted about 5 centimeters or so and held in place with a small balloon. Air will pass through this tube to make your bowel show on the CT scan. You may feel some pressure and cramping in your stomach as this happens. This is expected and should pass quickly. Once enough air has been injected, we will get you to move into position on your left side. You will have one CT done in this position and then a second CT performed on your right side. Each scan only takes a short while to perform. Once we're happy with the images we've taken, the tube is removed from your back passage. We will get you some tea or coffee and then you are free to go home. Your scan will be reported with one of our radiology doctors and the report will be sent to your referring doctor. You may pass some wind after the scan. This is expected. You may also have some mild cramping. If you have any significant pain with this, let us know. Otherwise, this will also pass. I hope this video has helped to alleviate any concerns you have about your upcoming scan. If you have any questions, you can contact us on the following number.